Well, good afternoon, and thank you so much for joining us for the virtual chronic pain education series. It's brought to you every Saturday at noon by the Global Pain Association. My name is Ron Aaron Eisenberg. I am your MC and host for today's event. This is number 11 or 12 in the series that began in May, continues for July and August, and it's brought to you by our friends of the Global Pain Association, the nonprofit organization dealing with and helping those struggling with chronic pain. Today's topic is a good one. A whole lot of folks with chronic pain are interested in whether supplements and chronic pain can go together. Are there supplements you can take that will ease the pain and perhaps reduce the amount of prescription drugs you need to be taking? Our special guests today, Dr. Pendleton Wickersham and Dr. Marianne Pinkston, both are MDs and are experienced in dealing with pain. And in Marianne Pinkerston's case, she struggles with rheumatoid arthritis, so knows firsthand about pain. And Dr. Wickersham also struggles with a chronic pain disorder. This week's program is brought to you by Annie's Apothecary. Annie's Apothecary is the best resource for achieving optimal health and wellness through the art of compounding nutritional supplements and patient education. Annie's Apothecary is a PCAB accredited compounding pharmacy. It serves patients all across the state of Texas. Their pharmacists are knowledgeable in supplements and compounds for chronic pain, including low-dose naltrexone. And we're going to have to ask Dr. Wickersham what that is, naltrexone. First, let's bring Dr. Susan Blackwood on board. She was the initiating force behind creating the Global Pain Association. And Dr. Blackwood is well known across this community for her work with professional and athletic sports. She was responsible, but way back, bringing the men's and women's Final Four basketball tournaments here to San Antonio. And we got them coming again, fingers crossed, in 2021. Both the women will be here looking for the men as well. And Dr. Blackwood, what was your idea in creating the Global Pain Association?
Well, Ron, again, thanks for being our moderator and for the Eisenberg Group putting this series together for us. Our board's really excited about having this for the rest of the summer with so many topics. And we want to be a resource for people with chronic pain in the country, basically. We're having people watch the series from all over Massachusetts, Colorado, a variety of different places, because people want to know how to find alternative ways to manage their pain. And their caregivers are just concerned about it. So we hope that we'll be bringing resources and knowledge and skills to people to help them achieve that goal.
And it's a free program.
Absolutely. We're always looking for donations to keep the series going, and we can talk about that a little later. But we've got wonderful sponsors and lots of caring, giving people that have put this together.
And we'll share later how to get involved directly in the Global Pain Association, how to donate, how to become a part of the program. And we're also looking for ideas for topics that we may not have covered. So feel free to email Dr. Blackwood, and we'll give you that email address toward the end of the program. So get a paper and pencil ready, and that'll be there for you. We want to move on, and Dr. Blackwood, we'll talk to you again in just a few minutes. And let's bring on Dr. Pendleton Wickersham. Penn is a member of the board of the Global Pain Association, earned his medical degree with honors from Baylor College of Medicine in Houston, Texas, board certified in internal medicine and rheumatology, partner in the San Antonio-based Arthritis Associates, consults and speaks before many groups, and has invented several medical devices. Dr. Pendleton is a leading physician of the world, 2011-2018, Texas Monthly Super Doc, 2015 to the present. He keeps his cape in the closet. A board member of the Global Pain Association, and he turns out he would have been a geophysicist had he not been doing medicine. He's a tumbler, he has rocks all over the house. Dr. Pendleton, great to see you.
Thanks, Ron. I'm glad to be here. And it is true that my wife will no longer allow me to bring rocks into the house. I've reached the rock quota as it is. Geology was an awful lot of fun in college, that's for sure. So,
well, we shared that. I'm a Snoopy collector, but we're down about 4 months worth of Snoopies, all gone.
Oh my goodness. Okay.
Yeah, it happens. It happens. So tell me, what is naltrexone?
So naltrexone is a really interesting molecule. So it's a cousin of naloxone, which is used for overdose patients to completely block any narcotic effects.
Yeah, I thought the
Now,
word was
yeah.
familiar.
And so it's a cousin, has similar blocking effects on the opioid receptor to block narcotics. It was developed many, many decades ago as a drug called antabuse, which was used, still is to some extent, for alcohol dependence. What's been discovered lately, and Dr. Pinkston probably knows more about this than I, is that it has some very interesting effects when given in low dose. The first thing it does is it seems to deplete the body's natural endorphins, and the body then makes a surge of endorphins. So people feel better. Pain is decreased for most people who take it. What's also really fascinating, though, is there's an emerging body of evidence that it has some really important anti-inflammatory and anti-autoimmune properties. It was first studied in multiple sclerosis, but now there are studies in multiple other disease states. So that's kind of all emerging, how much of an anti-inflammatory it can be.
Well, I thank you. And I thank you for being part of this program.
Sure.
You've had a great presentation. So our producer, my wife, Gina, said, don't chit chat, get pen on and do the thing. So let's have your presentation.
All right.
No more chit chat.
All right. Let's get started. So what I'll be talking about, I have a few slides here, which will be coming up in a minute, about a few different supplements, and then Dr. Pinkston after me will talk about her perspective on a few different supplements. So let's go ahead and get the slides up, and we'll get started here. So I started with a supplement list, and this is by no means comprehensive, but it does give you a sense here how many different supplements have been shown to have benefit for pain. And so when you talk about taking supplements, I have a couple points to make. One is I wouldn't recommend starting on a supplement regimen, especially if you're on medication, without clearing it with your doctor, just to make sure there are no interactions or safety issues. I'd also not recommend taking everything on this list. I heard of a Silicon Valley entrepreneur who's big into supplements and basically longevity, who takes 90 different pills and tablets and capsules of supplements per day. And that's basically, you take your cereal bowl in the morning and you fill it up with supplements, pour some milk on it, and that's your breakfast. And that's not what I would recommend. But there is data for each of these. So the overall idea I take with supplements is they're a piece of the regimen for so many people. So they don't replace medications, but medications by themselves are often not enough either. The way I look at starting supplements is to pick one, to give it some time, see if it helps, see if you have any trouble with it, and then decide whether to continue it before adding another or switching to another. Because I will tell you, supplements aren't cheap, right? And so the last thing you want to be doing is taking 6 or 7 of these, which may or may not have benefit, but certainly have an effect on the wallet. So we'll go ahead to the next slide here. Go ahead.
I was going to say, it doesn't always say on the label what it may help with. So how do you know?
So there's fortunately a lot of research out there now. A good basic place to start is to search the supplement name and WebMD. And WebMD has some basic background about what's out there in the medical literature. Also some information about interactions and safety. So that's actually a really good place to start. I'll start with turmeric. I'm just going to cover a few different supplements here, some of my favorite. So what is turmeric? Turmeric is the powdered root of curcuma longa, which is a plant, and it's ground up and used as a spice in many different cuisines, especially Indian cuisine. So when you go to the grocery store and you pull the spice off the spice rack, that's just ground up root. It's been used for many years, actually over 1,000 in Ayurvedic medicine. It has anti-inflammatory and antioxidant properties, but most of the benefit comes from one specific chemical in the root called curcumin. So there's a lot of confusion about what's curcumin and what's turmeric. Curcumin is about 5%, sometimes a little less, of powdered turmeric. Next slide here.
And you need to define that word Ayurvedic as well.
So that's the Indian medicine holistic medicine tradition.
Like
so
integrative.
It always gives me comfort to know that people have been using turmeric and we'll talk about boswellia in a minute for over 1,000 years, natural practitioners. So these are things that have been long tested and long tried. So that makes me a lot more comfortable with them. So we do have data now for curcumin, and there are a lot of studies out there. The best ones show benefit for arthritis pain, for nerve pain, including diabetes, nerve-related nerve damage, and nerve injury, and even for muscle pain after exercise. The standard dose is 500 milligrams twice daily with a meal, and I'll talk about that in a second. Now, so what do you take? How do you know what to get? Well, the first thing is you look on the bottle and you make sure that this is a certified manufacturer, and it'll say FDA GMP, good manufacturing practices. And so that means it's a clean place where they're honest about their components and their ingredients. But then the second thing with turmeric in particular is it needs to be concentrated to 95% curcumin. And so if it's 95% curcumin, then you're getting the good stuff. And so what some companies have done is they use a so-called proprietary blend where they don't have to list exactly how much powdered root and how much is the more potent curcumin extract. I would steer away from those because it's more expensive to make the extract. So you can bet if they don't put the amount on the label, it's probably not 95%. So we'll skip ahead to the next slide here. And this talks about some of the problems with curcumin. So the first is that it dissolves only in fat. It doesn't dissolve in water. And so it has to be taken with a meal to be absorbed. Some people, even with a meal, will note some stomach upset, so that's something to watch for. And there have been some drug interactions reported, in particular with blood thinners, with oral medications for diabetes, and potentially for chemotherapy. So in those settings, I would be very cautious and make sure your doctor is aware of what you're doing. But this is classified by the FDA as generally recognized as safe. So that means that's the status the FDA gives a food supplement when they basically think it's a safe thing to use. Next slide here. Unless you have a question here, Rhonda, we'll skip ahead to Boswellia here. So what's Boswellia? So Boswellia is a sap, really the concentrated resin from the Boswellia serrata tree. It's also used in the Ayurvedic Indian medicine tradition and has been for over 1,000 years. And it clearly has anti-inflammatory properties. And there's specific boswellic acids which have been extracted. And they have effects like ibuprofen or naproxen on that very specific type of anti-inflammatory effect. But they have other anti-inflammatory effects as well that many people think make them more balanced in that sense.
I think what's interesting here, Ken, these were developed before any of the pharmaceuticals came on board now. When you say 1,000 years, that's a lot of trial and experience with a medication.
Yeah, so I often wonder how they convince, how the group of people together 1,000 years ago convinced somebody to try this tree sap, right? But it is amazing how inventive and creative and industrious people have been for a long time on this planet. Go ahead to the next slide here. So what have studies shown? Benefit for arthritis pain, for inflammation in general, and possibly even for ulcerative colitis. There are quite a few studies with ulcerative colitis. The dosing is really tough on Boswellia because it depends upon the concentration of the sap. So I can't really give you a recommended dosing except to follow what's on the label because it varies how much the individual manufacturers concentrate it. And again, it needs to be taken with food for absorption. On the next slide here, we'll talk about some of the cautions with Boswellia because, again, it functions as an anti-inflammatory, so stomach upset can happen. And so if you can't take ibuprofen or naproxen, I would be careful about Boswellia unless cleared for it by your doctor. We really don't know much about drug interactions with Boswellia. The dosing can be challenging because it varies from product to product, but again, it is generally recognized as safe by the FDA. And we're coming up to the end here of my section. One more slide.
And one more question for me.
Sure.
And that slide on Boswellia is a perfect lead-in. There are some PCPs, as you know, Dr. Pendleton, Dr. Wickersham, who don't like supplements. And when their patients say, hey, I'm thinking about X, they'll talk them out of it.
And I struggle a little bit with that because it's tough. The supplement literature is not as clear as it is for FDA-approved medications, right? So to get through an FDA approval for a pharmaceutical is a much higher hurdle in terms of proving effectiveness and improving safety. So the problem is that for a lot of people, and that's the reason global pain is here in the first place, prescription medications aren't enough. And I really think that we should all look at every possible way to get better. And whether that's a prescription medication or a supplement or physical therapy or acupuncture or all the different things you've heard about through this global pain series, why not take what you can from all of these components to get as much healing as possible?
Makes sense.
I think so, right? So
Right.
move to the next slide here, and this is my last slide. So I'm just going to cover quickly a couple of other supplements. Glucosamine and chondroitin. When I finished my training, there were all these studies showing benefit in knee pain. There started to be other studies showing it didn't help. A lot of the studies that show the most benefit were funded by the manufacturers. A lot of the studies which didn't show benefit were more independently funded. So it's quite controversial. It does work for some people, but the literature is not really strong now in support of it. Avocado, soybean, unsaponifiables, ASU have great data. So that's actually a prescription medication in the European Union called pisclidine. And because of that, it has been used and studied ad nauseum. So lots and lots of data. And the safety data in particular is excellent. The problem with ASU is it's a little hard to find. It can be a little pricey. And it can take several months to reach its full benefit. So it requires a real commitment if you want to give that a try.
Now, it works on pain?
It does, actually. It has some complicated and frankly not completely understood anti-inflammatory effects, and so it does seem to help pain.
Cool.
Omega-3 has good evidence for arthritis. There's been a lot of negative press about omega-3 because of the cardiovascular data, that perhaps just taking an over-the-counter omega-3 doesn't prevent heart disease. And that may be for several reasons, one of which is omega-3 is not omega-3. And what I mean by that is there's a lot of stuff out there which is not really fish oil. It's manufactured in the lab. It's artificial. It has what's called ethyl esters, and it may actually have more harm than benefit. So if you're going to take omega-3, you have to be really certain of quality, which means it has to be from fish, ideally cold water fish, has to be tested to make sure it doesn't have mercury or other contaminants such as dioxin and PCBs that can be in the large fatty fish. And ideally, it's got to be packaged in an oxygen-free environment because it can be oxidized or damaged by exposure to oxygen. So good omega-3, whether it's a liquid or whether it's capsules, can actually be fairly pricey as well. But it does, in the literature, help joint pain in particular.
Now, I've heard you say it is heat sensitive.
Oh, absolutely. So that's the other thing is, don't go on Amazon and order some omega-3 gel caps right now, because chances are by the time they get to you in this heat, you won't have a bottle of gel caps. You'll have a bottle of one large, irregularly shaped, melted together gel cap, right? So I think it's not only is does the gelatin melt, but it could potentially damage the omega-3 as well. Finally, SAM-E has been shown and been known for years to work for pain. It also seems to help mood. And actually, it's a pretty effective treatment. The problem with SAM-E is it's really pricey. So of all the supplements we've talked about today, it's the most expensive. But again, good data for benefit. So that's all I have, Ron. I'll be happy to turn it over now to Dr. Pinkston to talk about some other supplements, and we'll have some questions, I think, at the end here, right?
Bring the two of you back together at the end of her presentation, which gives me a chance to welcome Dr. Marianne Pinkston. We're delighted to have her on board. She is a graduate of UT Health here in San Antonio. Dr. Pinkston in family practice and integrative medicine, owner of Pinkston Medical and Wellness Clinic, medical director of Dolce Med Spa, lived with rheumatoid arthritis for 13 years and has struggled with that pain. And Dr. Pinkston, it's really great to see you. Tell us, for those who don't know, what is integrative medicine?
So integrative medicine is becoming widely, popular now, thank goodness, because I think, with contemporary medicine, we are just trained about pharmaceuticals and a very, algorithmic type of medicine. Integrative brings in a whole holistic side of medicine where we are more accepting of some of these things that we're talking about today, and, brings the contemporary and the holistic side together. And I think that's a very great opportunity to heal patients.
Yeah, and you've had a chance to put together a little presentation as well, and we'd like to do that. And then you and Penn have agreed to question each other. It's Penn,
Marianne
face-off.
That's right, the Duke out. Yes, absolutely. And I am absolutely incredibly honored to be with the Global Pain Association today and to have this fantastic opportunity to talk, especially alongside Dr. Pendleton Wickersham, who is my physician and has me on some of these supplements as well as some very important medications. And I've done very well with Dr. Wickersham. I'm very, very happy. So thank you for bringing up my slides. The supplements that I'm going to look over with you is they are supplements that are good for chronic pain, such as inflammation, arthritis, which we tend to focus on a lot. But there are other types of pain that are important to people. I think muscle pain, muscle spasm, people have chronic back pain, chronic muscle issues, things like that. There are many types of pain out there, surgery, post-surgery, whatnot. So if we'll advance the next slide, I'll start with arnica. So arnica is a daisy. It's a flower, and that's where we get most of the properties from. And arnica is a topical only. It's not something that you are to take internally. Be careful also with broken skin because that will escape internally as well. So people will use oils, creams, salves. Those are some of the things that, some of the words that come with something topical. Also bath salts. The arnica is interesting because they used it in the mountains thousands of years ago for people who were experiencing frostbite. So it warms and it opens up the vasculature and it brings, blood flow to a painful site, which is great because you're bringing in healing properties. Inflammation is not always all bad. Too much inflammation is, but we do need those healing properties to arrive to the area to heal. And so arnica helps with that. It does help mostly with arthritis and inflammation, but the thing I really like about arnica is it helps with muscle pain. You can combine it with magnesium, which I'll speak about in a few minutes, to help with joints and muscles and tendons. And so overall, just body pain. It has been put into an oil and used for toothaches. It generally helps with inflammation, swelling, but they'll use it with surgeries also to diminish bruising. And, cosmetic surgeries and whatnot, or any surgeries really to help advance healing and decrease bruising. So
one of the challenges facing folks with diabetes, they can't get real good blood flow into extremities. Now,
right.
Does arnica help boost that blood flow?
The problem with diabetes is the death of the small capillaries. So if anything you can do to bring in more blood flow to an area, once the capillaries are gone, they're gone, unfortunately. We're working on things that help to regrow capillaries. But yes, I think that that could be something to help.
Good. Next slide.
Yes, please, next slide. So one of my favorites actually is cat's claw for a lot of different reasons, and mostly because of the name, I think, but it's a woody vine with a hooked claw or thorn, and it's from South America, hence its name, cat's claw. What they do is they take the inner bark and make a powder of it and, put it in gel caps. And generally, it will enhance white blood cell function, which makes, good use for many types of problems, such as anything in your immune system. So if you have a bacteria, a virus, a fungal issue, then it will bring in white blood cell and bring your immune system up to fight that. But it also helps a lot in the gut. And so there's a lot of talk these days about gut flora, gut health, the microbiome, all of those, buzzwords. The gut is very important to our immune system. And it's basically, I think, the tower of our immune system to protect us. And anything that we can do to improve our gut, so to speak, improve the bacterial flora that grows there, to help boost our immune system is very, very important. And cat's claw can help with that. So it balances gut inflammation also and is used in a lot of gut problems. So many people have chronic pain from, Crohn's disease, ulcerative colitis, IBS even, and it helps with that. It does lower inflammation for arthritis, so it decreases swelling and helps with pain. It also lowers blood pressure. So there are people who use cat's claw to reduce their blood pressure. I wouldn't, go against your doctor's advice with your medications, but it can help with lowering blood pressure. So actually, if you are taking blood pressure medication, that would be something to be careful of. It also helps with the overall fatigue that patients patients get. A lot of people with immune system disorders feel not only pain, but incredible fatigue. It helps with that too. And it's about, 60 milligrams a day. So whether you break it into a 20 milligram 3 times a day or, 60 milligrams all at once, that is, whatever works for you. But that is generally the dosage that is asked for there.
Now, are you also recommending a probiotic in order to boost that gut health?
Absolutely. So gut health is a very long, complicated topic, and but probiotics are wonderful. And I, have a long talk with that. I did on my former radio show with picking a good probiotic. That's a bigger subject than we can do here, but yes, absolutely, probiotics are very important to that.
Okay.
So next slide, and then I'll talk about my favorite. Okay, magnesium. I think a lot of people know a lot about magnesium, but so I'd like to bring a couple of interesting points about it. Of course, it's a mineral that keeps our heart going. It is a must for our heart. And the thing that is interesting about it is, you go to your doctor and you want to check your magnesium levels. There's a lot of difficulty for doctors in checking that because magnesium has to be normal in your bloodstream at all times. So if your levels are low, it's because your blood system is stealing it from your muscles and from your bones and organs. And so your blood levels will always read normal, but your tissues will always be low. And that is where the deficiency is. So do not go to the doctor and count on seeing, what is my magnesium level? Well, you're not going to know because you have to keep it normal in your blood. When it's deficient in your tissues, you ache, you hurt, you cramp, and that's why people have leg cramps at night, restless leg syndrome, things like that, muscle spasms, other things like that. So when you want to replace magnesium, there's many, many different ways of doing that. And so you have to look at what, it's not just magnesium on the bottle. It's always combined with a salt, so to speak. So magnesium citrate, we've all heard of. And then my favorite's magnesium glycinate or 3-in-8. And the difference in the names in the salts is very, very important as to how you take it. So the magnesium citrate, when you take it, does not absorb into your bloodstream. It actually stays in your GI system, and that's why you get diarrhea. So it's a very good, it's very good for constipation. When you take something like magnesium glycinate or 3-in-8, it actually then gets absorbed. So it replenishes your blood supply and helps with many, many problems such as the muscle spasm for chronic headaches. So if you're a person who gets a lot of upper neck and back muscle spasm, chronic headaches, you can take magnesium orally, and that is a great muscle relaxant. And I usually recommend about 600 to maybe 800 milligrams. Just caution watching your bowels there. Some of it will stay in the GI system. You can also then do it in the reverse and get into a bath. So salts and bath salts and is a great inflammation reducer. It also soaks through your skin, so you absorb magnesium very, very well through the skin, and that will reduce the spasm and pain. And the last thing, I guess, people wonder how much do I put in a bath. So get a good warm bath and something you can soak in 2-3 very heaping cups full. I mean, don't make it thick enough to be paste, but put enough in to really dissolve and sit in and stay for about 20-30 minutes.
I'm ready.
It works very well. Yeah, right.
Yeah, exactly. Now, you and Pan have agreed to chit chat a little bit. So after this slide, maybe we could
go right to that. So last thing is bromelain. This is very short anyway. So last thing is bromelain. It is made from the pineapple. So if you eat lots of pineapple, you will get plenty of bromelain. And really, it's suggested that about 500 milligrams, 1 to 2 times a day is wonderful. And we use it a lot post-surgery. Actually, not just post, but before and after surgery to improve your healing, your pain, inflammation, and your bruising. And it really acts like an NSAID or like Motrin or Aleve or one of those NSAIDs to, and it's actually close to that of a prescription form of diclofenac, which is a prescription NSAID. And it has been shown in studies to be very, very effective in pain relief. So that is my short little stack of pain relief.
Cool.
Yeah.
Well, let's bring Penn on board, and this is Doctor and Dr. Patient talking together. And as the two of you listened to each other's presentations, and I'll start with Penn, is there anything you want to add or ask about Marianne?
So I really want to back her up on the magnesium. So, it in medicine, we learn to check a blood level and then feel good or bad about it, right? But the blood level in magnesium is absolutely not accurate for total body magnesium, which is what we're talking about here. And there is really not a good way to assess total body magnesium. As Dr. P says, a lot of people are deficient. There was a research protocol doing a biopsy to try to determine that. I wouldn't recommend doing that, right? We're not going to biopsy you to get your magnesium level, but it is commonly low, and having a normal blood test does not mean that your body magnesium is normal. So double thumbs up on that, Dr. P.
Well, you can go by your symptoms. Really, it's very easy. I can identify anybody very easily in clinic by their symptoms. So that's really, we don't need a blood level. I can tell,
What would a symptom be?
So really the muscle cramping, I think, is the main one. Fatigue, horrible fatigue, and just kind of the slow functioning of anything muscular, just thinking anything that requires use of your muscles. There's a longer list, but those are the main ones. I think that.
Now you had a chance to hear Penn's presentation. You have a comment on something he brought up you want to talk with him about.
Well, first of all, I would really like to congratulate him on that word piscaline. I think I, have significant problems with that, but that's wonderful. Actually, I'm just teasing. He started me on this fairly recently, and I feel like I've had some good response from it. And so I really want to hit that. And there's some good sources that you can give. You can always, ask us. But the all of those that he have listed are things that I have tried and have worked very, very effectively. And so it's a very good list. I really think he nailed everything. I don't have much to add.
Where can folks go to get more information? What do you think, Ben, Marianne? Where would you go?
So,
go ahead.
Dr. Okay, I'll start with, so information, as I said before, about the products themselves, about the supplements themselves, about it, whether it's something you want to try, whether it's something you feel comfortable trying. Again, if you just Google it with WebMD all together in the search string, that's not a bad place to start initially, because there is a summary of what's known about how effective it is, how safe it is, and drug interactions just there. So I've found that to be pretty useful. Dr. P, though, I'm sure knows a lot more sources than I do. So what do you have to say, Dr. P?
I am digging very hard for a book that I think I apparently left at home, and it is, but it's something that I can put up on for you on if you go to Pinkston Medical and Wellness on Facebook, or at Pink Raider MD on Instagram. Not to promote myself, but I can leave that for you, and it is a great textbook that people can get to for just something to keep in your house, so that you can look through and recommend. But I agree with Penn as well. That's what I use and a resource. I also go to like a4m.org and we'll use a database that they have and, look for more integrative type of, or Josh Axe, Dr. Axe, DRAXE.com. And that is another good place to get really great information on supplements.
Well, last question. One of our viewers or listeners, I guess you're both, you're looking and listening, had a question about, this is from Gloria Vasquez. Any recommendations on where to go to get quality supplements?
Good question. So for supplements, I generally will use, I have a Full Script or Elevate. The problem is that they are doctor driven. So you have to, have a doctor who is part of these dispensaries, and they're all, tested, tried and true. I use Orthomolecular or Zymogen. And I think these two companies are very good at third-party testing and keeping up with their, their P's and Q's on getting the best science out.
And Penn, without getting into endorsing retail.
Sorry, I don't mean to do that. It's just
it's great. Without getting into endorsing retail, Whole Foods has bragged for years about we're your place for supplements, and there are others.
Right.
What do you suggest? Retail, or again follow what Marianne is suggesting?
So if you have access to a holistic integrated provider, then that's going to be wonderful, right? So you're going to be really confident that what you're getting is excellent quality. If you're going to go to a resale place, just go to a place where they know what they're talking about. And so in other words, when you ask questions, they're able to answer them. And in particular, one way you can tell is that they're honest about not just the potential benefits, but the potential concerns and what to watch out for and the risks. So if you go somewhere and they say, well, this is the best thing ever, there are no side effects and you can take it with any medication, then I'd be a little bit cautious, right? So
I apologize. There's a delay, I guess.
No, go ahead.
The only thing that I worry about when I go into places like that is usually there's just, somebody who approaches you, kind of a young kid, maybe in college, no offense to anybody, but, I don't think anybody's really well trained at, the supplements that are there. Some of their information may be a little anecdotal. So I agree definitely on the provider, trying to find somebody who really knows about it. And there are lots of different types of herbalists here in town that actually have, and I could always give access to that if anybody wanted to know, but that really have some good information. So I guess I'm very cautious about the stores.
Well, unfortunately, we got to say thank you to both of you, and we'll pick this up at another point. And maybe at some point, we ought to take a deeper look into probiotics. Thank you, Dr. Marianne Dixon. Thank you, Dr. Pendleton Wickersham. We appreciate you sharing your time with us.
Bye, everybody. Thank you all.
Bye-bye. And let's bring back, if we can, Dr. Susan Blackwood. I know she was busy taking notes, and she spent some time as we get ready to talk to her. We're going to tell you about Annie's Apothecary. It's a PCAB accredited compounding pharmacy, and they are one of our sponsors this week. Compounding is the art of making custom-made prescription medications specifically for an individual patient and their unique needs. We use state-of-the-art technology with FDA-approved ingredients so that your finished medication meets your doctor's exact specifications. You can check out Annie's Apothecary at www.anniesrx.com. And now Dr. Blackwood has a chance to put down her pen and pencil and join us here in the closing moments of our very special program that comes to you every week, our virtual chronic pain education series, brought to you by the Global Pain Association. And then right on cue, there she is, Dr. Susan Blackwood. Susan, this was absolutely fascinating.
Yes, it was. And I know people were taking notes, but I just want to remind everybody that this will be on our Facebook Live, our Facebook page for Global Pain, and our website, and will live there forever. They can go back and review it many times. And thanks for bringing up Annie's, our sponsor, because that has been recommended to us as a place to get good supplements. And I'm glad that they were able to sponsor today's segment. Of course, Ron, our website needs to be a resource, and we're working with our advisory council and our board to make sure a lot of these sites that were mentioned today are places that can be posted on our website so that people can find them and also get more information about Global Pain. So they can send us a message at info@globalpain.org, or they can make a donation. No donation is too small. And they can go to our website, pull down how to get involved, and there's a donation button, and we'd love to have their help.
And how about folks who want to recommend topics?
Again, go back to info@globalpain.org, and we check that regularly, and we'll find the other suggestions that they have.
Susan Blackwood, thank you so much. We appreciate it. Next week, right here on the Global Pain Association Facebook page, July 18th at noon, the role of acupuncture in chronic pain with acupuncturist Scott Taylor. He'll be our very special guest for our chronic pain presentation. And we come to you through the month of July and into August and through August as part of the Global Pain Association's weekly series. I'm Ron Aaron Eisenberg. I thank you for joining us, and we hope to see you again next week for another edition of this special program on combating global pain. Have a great weekend, everybody.